therapist. Today I'd like to talk to you about a very specific exercise that has been shown both in the research and as well as in my clinical experience to be beneficial with individuals who have had persistent neck pain, or neck pain that's been there over a prolonged period of time. The name of this exercise for the neck, it's essentially a form of proprioception training. And essentially what that means is our proprioception is our kinesthetic sense of where our body is in space. So you've probably heard of this with regards to ankle sprains, for example. So when an individual sprains their ankle, a lot of times the individual will really struggle with their balance and their ability to maintain their balance and where they are in space, essentially, with their eyes closed. So this same sort of proprioception sense can and has been shown to be affected when individuals have persistent pain over a prolonged period of time due to this sort of kinesthetic feedback, essentially. And so you can actually retrain this in the neck, and again, it is shown to help with regards to a person's pain scale, essentially. And so I want to go over these exercises today with you. And so it's a very straightforward exercise. Now, essentially what you do at home is you would find, you go looking straight against a wall, essentially, and you find a spot on the wall and you sort of keep your focus on that spot. And then what you're going to do is essentially close your eyes, right? And you're going to start by looking down very, very slowly. Now, as you're looking down, if you start to feel any sort of pain or discomfort, you're going to then go back to that starting point. And now the goal is essentially to get back to that starting point where you looked at that spot against the wall, and then you're going to open your eyes and see how close you can get to visually looking at that same spot. They do actually have these sort of laser pointers that that you can buy that go around the forehead, essentially, and then in the clinical setting you can actually set up almost like a bullseye in which you want to get that laser right back to that starting position with the eyes closed. Now, you would go in multiple essentially directions when you do this. So again, I'm going to close my eyes. Now I'm going to go up into that extended position. Super slow. You want to really get a sense of moving in this very slow way. And then again, if there's any sort of pain, you stop. You're going to go back to that starting position again. And then as soon as you feel like you're back to where that laser, so to speak, would be right at the bullseye, you're going to then open your eyes again. And then you're going to do that again in a rotational way. So rotating to the right, super slow, back to that starting position, and again opening the eyes. And you would do that either rotational movement, you can do it with side flexion as well, going back to that starting position again. I would suggest having somebody advise you on this when you're doing this exercise, because what I do find for quite a few individuals is that they tend to go a bit too quickly, and that they're a bit too aggressive and tend to go into the pain with this, which again is not the goal. But what you should find is that over time, this sense, this proprioceptive or kinesthetic sense of where your head is in space will improve. And that, again, from a research standpoint, has been shown to improve an individual's pain scale. So if you have any questions or concerns, feel free to leave a comment below. And thanks again for watching. Take care.